As we all struggle to keep up with soaring food costs, a new study is highlighting how youth in homes with food insecurity are seeing higher reported instances of mental health issues. And there are calls to take action. Here at the Eastview Boys and Girls Club in Toronto, Lorette Jack knows firsthand the importance of making sure children are properly fed.
When there is a lack of food, nutritious food, access to food, that it can create all kinds of mental health issues. In terms of the kids, there's anxiety, depression.
It starts with teaching them about
healthy food choices and how to make meals out of low-cost items.
But education can only go so far. Keeping up with children in need is often a struggle for this nonprofit.
I've been working with kids for 34 years and with BGC for 30, and it's an ongoing issue, but just with the rising cost of food and so much generally in life that's going on, you definitely are feeling the impact.
The club operates snack and meal programs made up of fresh food and non-perishables and rescuing food from businesses as a band-aid solution to help families.
We hear kids talk about being hungry all the time. We found 3 nights in particular, in the middle of the week, our kids were devouring food, they were hungry.
But a new study in the Canadian Medical Association Journal says food banks and charitable programs like the one at Eastview aren't effective enough to reduce food insecurity.
A family that is struggling to afford enough food is also struggling to afford all kinds of things like rent, utilities, other things that those children would need.
Nutritional Sciences Professor Emeritus Valerie Tarasik says a review of data from a decade ago provides a startling finding when it comes to accessing mental health care.
Children and adolescents in food insecure households had a 55% higher prevalence of outpatient contacts and a 74% higher prevalence of acute care contacts.
A variety of issues have been found, such as substance abuse, mood anxiety, and neurodevelopmental disorders.
This is just a small slice of the extent of the problem.
Experts are pushing for newer data, greater advocacy from the medical community, and better research on interventions to cut food insecurity. Tarasik adds provincial social assistance rates and the federal child care benefit aren't helping enough.
The fact that we have about 1 in 4 children under the age of 18 living in a food insecure household in Canada right now is nothing to celebrate.
Back at Eastview, Jack urges decision makers to do much better and quicker to address the ongoing food crisis.
There's a broader systemic issue. How do we supplement families on a whole, not just individual organizations looking to do our small part, which is huge, but still not big enough. There is no mental wellness without making sure your tummy is full.
We'll have more on this study and this issue at citynews.ca. In Toronto, Nick Westoll, City News.